Hello and welcome to Total Health with Dr. Nick, where my purpose is to inspire, empower, and motivate you to live longer, healthier, and more abundant lives. And guys, today I've got a great video for you because it's something that affects both teens, children, adults, seniors. It virtually affects everybody, and that is scoliosis. So what I want to talk to you about today is the truth about scoliosis and how to correct it. But I'll tell you, before we get started, I've gotten the most amazing testimonials from you lately, and I want to thank you for that. In fact, I want to read a couple. I want to do some shout outs because you have been absolutely amazing. I put out a video just recently, and I've never gotten more warm, compassionate, heartfelt. Like I said before, I tear up reading a lot of your testimonials and your comments, but these were beyond compare. So I want to read a couple of them for you so you can get an idea really just how great you're doing, what kind of rock stars you are out there. You are crushing it. So I'm going to put on my cheaters here because I don't read as well without these things. So anyway, this is from Kathy A. Since we've been following your advice, my husband's A1C, and that's what doctors use to measure diabetes, has dropped from 7.2 to 5.3. Amazing right there. He did not have to go on metformin, and his physicians are so happy. I call him Slim now. He looks like a guy I married 28 years ago, and we were in our early 40s. I'm going to have to take in all my clothes. Sorry about that, Kathy, that I'm costing you money here. He's back in a stack of chinos he's kept for years. He never thought he would ever be able to fit into them again. Your site has completely changed our lives for the better. He'll be 70 in a few days, and he has given himself the best birthday present ever. Thank you so very much. That's Kathy A. Here's another one. By the way, Kathy, I don't even know what to say. I don't even know. You made my day. You made my year. This is from Shauna M. You're the best, Dr. Nick. I wish you were in my area. I wish I was in your area too. I watch all your videos, and you have given me so much insight and hope. I had endometrial cancer and a total hysterectomy, and now I'm living a ketogenic lifestyle, and I've got you to thank for all my motivation. I'm getting choked up now just reading it. And just seeing you on YouTube's bring me such hope. Thank you so much. Well, thank you so much, Shauna. You're a rock star too, and I appreciate it. And guys, I tell you what, sharing your comments, helping each other out is really what our community is all about. So I thank you so much for that. You are all rock stars, and I thank you for supporting our channel. Anyway, like I said, today's video is all about scoliosis. So I'm going to get myself dried off here. Scoliosis, like I said, affects everybody from teenagers, young adolescents, all the way down to 4 years old. We've had patients with scoliosis, all the way up to senior citizens. It gets very dangerous when you're dealing with senior citizens. So hopefully today, my purpose in this is to just give you hope, give you inspiration, give you ideas. And if I could save, change, and transform one life today, then my job is done. Because I will tell you that scoliosis is devastating on a physical level, health-wise, on an emotional level, because many of you lose hope. Some of you get suicidal, and we're going to talk about that in a moment. And on a social level, because you feel like you're damaged goods. If you can relate to that, let me know, all right? A lot of you out there feel like you're not even a complete person. So please watch till the very end, because I'm going to give you some ideas of what we do in our office, what we've done over about 28 years. I'm going to show you specific cases of before and after x-rays, of cases we've taken care of, and we're going to give you some hope today. So watch to the end, because we're going to give you some specific examples. And of course, if you like what we're talking about, please make sure you like, share, comment, and subscribe. So let's go ahead and get started. So let's talk about why is it so dangerous to have scoliosis? And let's talk about what is scoliosis, first of all. Well, the way the spine is designed, front to back, here's your hips right here, here's the back of your skull here. So this is from the back to the front. Your spine should be straight. From the side, you're supposed to have curves. So just like this, you have a neck curve, mid-back curve, low back curve. Well, like I said, from the front, that's supposed to be straight. But if you start to see shifts or bends like this, whether it be 5 degrees, 10 degrees, 25 degrees, 45 degrees, upwards of 60 plus degrees where you can measure these curves, that's scoliosis. So once again, from the side you're supposed to be curved, but from the front you're not. Anything like this, you're in trouble, and I'll tell you why. Why is it so important? Well, it's because the spine is like a fuse panel. Your spine is designed just like the fuse panel in your house. Your brain sends messages down your spinal cord, out through the nerves, just like here. So the messages go down through here, down your spinal cord, out through these nerves on the side to every cell, tissue, and organ of your body. You've heard me talk about this. Go back and watch one of the videos I did on low back pain and diabetes. I talked about the neurological approach to diabetes. Well, the messages have to travel out from here to go to all the parts of the body. So you can go to your, for example, in your home, you might have the jacuzzi tub, you might have the bathroom, you might have the garbage disposal, you might have all the different appliances, the lights in the bedroom. You get what I'm talking about. And when you put these switches in the off position, you know those parts of your house aren't going to work properly. Well, the same thing happens in your body. When the vertebrae in your spine are misaligned and mouse shifted, rotated, twisted, they start to pinch off the nerves. And when they pinch these nerves here, that starts to shut down where that nerve goes. So if that nerve goes to your heart, your spleen, your lungs, your kidneys, your intestines, your colon, it will shut your organs down. Just like if you were to cut these nerves, the nerves get cut, the organs shut down. If you pinch the nerves, you're just going to shut the organ down slowly. So that's why scoliosis is so devastating and so dangerous, because it can start to cause sickness and disease within the organs of your body. Does that make sense? Okay. Now, some statistics about scoliosis. Well, first of all, it's the #1 most debilitating problem structurally in your body. So, scoliosis is the most common spinal deformity in school-age children. Over 4 million scoliosis cases in the U.S. And not only that, this causes a lot of problems with hospital visits, emergency room visits, and so on. So it turns out 442,900 office visits, 1,333,300 hospital visits, 17,500 emergency room visits, and 29,000 surgeries. Like I said, if we don't get this problem corrected in its early stages, and we're going to talk about that, you're headed for surgery down the road, not to mention a whole host of other health conditions. What am I talking about? The emotional toll. The emotional toll that scoliosis takes is catastrophic, especially when it comes to our teens and our adolescents. This is where it really hits home. When you get to be older and you're a senior, it doesn't bother you as much, but it causes health concerns. But when it comes to the emotional toll, this hits teens, your school-age children extremely hard. Take a look at some of these numbers. 50% report being less healthy overall. They just recognize the fact that because their spine is crooked and they know it, they just don't feel healthy. Not only that, 97% worry their bodies are developing abnormally. So they know just from the looks of themselves that they're not developing straight, they're crooked, maybe it's affecting some health issues already, maybe they can't breathe as well, maybe they're having anxiety over it, all these different things. 79% report greater concern about the quality of their peer relationships. And like I said, this affects children socially. Why? Because they feel like they're malformed, they feel like they're incomplete, they feel like they're just not good to look at, all these different things. And if this is you, you know exactly what I'm talking about. 94% say have greater alcohol consumption, 10 times more likely. And this is the scariest part. They are 10 times more likely to have thoughts of suicide. Once again, they're not feeling like a whole person. They feel like they're damaged goods. They feel like they're broken. They feel like they're not good with their peers. They're socially awkward. All these different things is what makes scoliosis such a devastating problem. And you've seen it. You've seen people walk around like this. They look malformed, malpositioned, and sometimes you can cover it up with your clothing, but a lot of times you can't. You feel self-conscious going to the beach. You don't want to go hang out at the pools. And forget about dating life. Dating life, you feel like you're a monster of some kind. And believe me, I understand that. I've seen that throughout my career. I know how it affects everybody, especially, I should say, our teens and our children. Well, let's talk about the kinds of scoliosis. There's different kinds, and you might not even know this. You might think, well, how many of you believe scoliosis is genetic? Well, my dad had it, so I have it. My mom had it, so I have it. It's not genetic. Get that right out of your head. There's actually two kinds of scoliosis. There's a functional and a structural kind, okay? So let's talk about both. In a functional kind, that means the spine is crooked because of maybe poor posture, maybe an injury, a slip or a fall, an injury to where you're now twisted or tilted or bent. And basically what happens with that is very simple. If you think of the spine as blocks, just like this, and you start stacking them one on top of the other and you have them all stacked up. When the blocks are sitting like this, of course, the spine is straight. But let's say you fall off a bicycle, you fall off a skateboard, you fall off of a ripstick or something, and now you tilt your spine because you cause a disc bulge. Well, just like in the middle there, these are the vertebrae. The space in between is the disc, and as you can see, it's wedged. It's wedged to this side. When it goes like this, the spine will eventually just keep growing that way, but the body doesn't want to stay that way. You're not going to walk around like this all your life. So what the body does is starts to bring them back to the midline. It starts to curve it back around, and that's where you start to see the beginnings of the S-shaped curve, okay? So it's basically just a functional scoliosis. There's nothing wrong so much structurally, and you'll see what I mean in a moment, but it's functioning wrong. It's curved in the wrong way. A structural scoliosis means there's a malformation. So as you can see here, this is just curving. In this case, you see this vertebra is not square. It's actually crushed. It's like a parallelogram or something. I don't know, a trapezoid, whatever shape it is. I don't know geometry anymore. I had it like 800 years ago. Anyway, so now what we're looking at is we have a foundation like this where we've got this edge that's crushed down. Once again, could be from a compression fracture, but most likely it's from a malposition. It then causes the next vertebra up to sit like this. So instead of sitting on top, it's now sitting like this, and now from there, they're all going to start to grow crooked. All because of a malformed vertebra. Now, this is genetic, this is not. This is genetic, this is not. I will tell you, in nearly 28 years, going on close to 30 if you count schooling, I've never seen this in practice. You just don't see this. Now, what you can see is you can see a maybe a compression fracture, but that happens later on. Typically, it's later on in life when a senior has a compression, a senior citizen. But this I don't ever see in practice. This is not what I see in teens. What I see is this. So this means it's not, this is genetic. I don't see that. I see more of the functional kind, which is not genetic, but instead it's because you fell, you had a fall, you had a trauma, you had an impact, or poor posture. You sit a certain way, you lean a certain way, you tilt. That's what's causing the scoliosis. Now, different severities. Now, you have the beginning stages where it's anywhere from 5 degrees up to 25 degrees. You start to see gradual curves in the spine. You might see the beginning of a curvature where you start to see just a little bend like that, just a tiny bend. Then that bend, when we measure it, and we measure it right through the discs, and we measure it, and we see in this case that might be a 10-degree curve. And so this curve, curving this way, if you drew a line straight out, you'd measure a 10-degree curve over here, all right? So that is the first stage. The second stage, you're looking at 25 to 40 degrees. That's where you start to see now the curve coming back, where you get the classic S curve. Like I said, it might begin with just a simple curve this way, 5, 10, 15, 20 degrees. Then the spine, what it tries to do, it tries to curve it back and bring it back to the midline. So you start to get this S-shaped curve. And when you see that, now you're seeing this, you're in a 25 to 40 degree range. Once again, we're measuring the angle here, we're measuring this angle, and now it starts to get even worse. Now you're over 40 degrees, all right? So each one of these is a very specific way that you take care of it. Unfortunately, in the beginning stage, what medicine typically does, and this is what your pediatrician may do, is they typically watch and wait. So they're just watching it at this phase, and they're observing it, and they're measuring it maybe. A lot of times they don't even take an x-ray. That's the scary part. What you may notice is they found it in school. Maybe a school nurse did an exam where they have your child bend over, and when they have them bend over, they're looking for the evenness of their back. If they see one side higher than the other, they're assuming that the spine is twisting and rotating. The only problem is you miss it most of the time. And I know this from experience. I've done school screenings, and I'll tell you what, the nurses typically miss it. I catch it because they're just looking for basic things. They're not looking for really the hardcore malpositions. I'll catch them when they're 5, 10, 15 degree curve, where they won't notice it till it gets up into the higher ones when they start to see the real malformations. But you want to catch it early in the first stages in this 5 to 25 degree stage. But like I said, the problem is most MDs, pediatricians, orthopedic pediatricians, they're watching it at this phase. Why? They can't do anything yet. There's nothing that they can do in this phase, so they just observe it. The problem is, what is gravity always doing? Well, if you've ever dropped anything on the floor, you know gravity is always pulling things down. So when a curve starts off as a 5 degree curve, next thing you know, it's a 10 degree curve, and then a 15 degree curve, and then a 20 degree curve, and like I said, then the spine starts to come back to the midline, and now you've got a bigger curve all under their watch. They've been watching it, but they couldn't do anything. Why? Because there's nothing that they can do in a 5, 10, 15, or 20 degree curve. It's not till they get to the higher numbers. Now we're in a 25 to 40 degree curve, and now they start to do bracing. Well, bracing, you've seen people like this. I grew up walking around in school and seeing children with braces around that looked like a straitjacket. Milwaukee brace, Boston brace, and then they had it up to here because they wanted to keep the head up straight. They tried to squeeze the rib cage together, hoping it would shift the vertebra into alignment. That was the logic, and they still do this, where they just put these braces on really tight, where they're trying to literally squeeze the spine together. Well, the problem is this. Number one, it causes respiratory issues. It causes anxiety issues. It's expensive. Bracing is upwards of $10,000. And here's the problem. Even if they put the brace on, when they take it off, it goes back to the way it was. So what they say is 23 to 50% of the patients who wear spinal braces will still end up needing spinal fusion surgery. And I'm going to show you that in just a moment. So why are we doing this? Because the reality is this. Once they take the bracing off, whether bracing helps stop progression or not, once the bracing comes off, the spine goes back to the way it was or worse. Why does it get worse? Because there's muscles and tendons and ligaments that are along the spine that are used to support and stabilize it. But just like anybody who's ever had a cast, in fact, we've had patients all the time who come in with broken wrists and so on. Their arm atrophies under the cast, and you've probably seen this yourself. Maybe you broke a leg, and then when you took the cast off, your leg was all shriveled up and small, because when you don't use it, you'll lose it, so it atrophies. When you have a brace around here locking everything together, or trying to, what happens is the muscles that support the spine, the ligaments and tendons, start to atrophy. And if they atrophy, now the spine just shrinks and bends right back into the bad position, or even worse. And like I said, they usually end up needing spinal fusion surgery. So that's what we see next. Here's we see what we call Harrington rods. And this is a Harrington rod right here. This is actually a rod out of one of my patient's spines. It's a solid steel rod. I mean, this thing is just, like I said, you can't bend this. Solid steel, stainless steel. And they go in and they insert them. They cut from top to bottom. They put them in place, they screw them in place. Back in the old days, maybe 40, 50 years ago, they used to wire them in place. They used to put them down the spine like this, and I'll show you an example of that in a moment, and they would chicken wire it in, just like that, all across here, trying to hold the spine into place. Now they go in with screws, big long screws that look like wood screws, but they're stainless steel, and they drill right into the spine and bolt these things into place. So you see it here, there's a double track there, a double track here, and here you could actually see the screws. Why? Because the vertebrae are twisting, and when they're twisting, now you have a different angle at these vertebrae. So these are the screws right here where you see this. Those are the screws because you're seeing a side angle of them. That's because the vertebrae are so twisted and torqued. Now the vertebra, instead of the screws going straight in this way, they're going in sideways. That's what we see there. And that is over 40 degrees. Now, problem with Harrington rods, really, really expensive. $140,000 for this type of surgery. And 1 in 5 patients are going to need more surgery. Why? Because the spine deteriorates, the spine starts to wear out. You have to have movement. There has to be movement. Muscular movement, body movement, just like this. As you're walking and going through your day, you're causing movement. That movement causes the discs to get fluid sucked in and out of them. The fluid is what gives the discs nutrients and then removes the waste. And as you're moving, it's a pumping effect. It's going in and out. Without that movement, because of the rods, everything's locked up. These will start to degenerate. When they degenerate, the vertebrae compact together, they pinch the nerves. So what is this fixing? It's fixing nothing. Not only that, 38% of the patients who had the spinal surgery said they would have avoided it. So almost 40% of the people who had this done said they never should have had it done. Why? Because they can't move. They can't do anything. Their life's activities are over. So what's the whole purpose of this? Nothing. There's no quality of life improvement. So the key with this is catching it early so that way it doesn't get to the stage where you have people like this. I saw this with one of my patients. Now, Michelle over here was 16 years old. When she was 16 years old, doctors detected a scoliosis in her. And what did they do? They went in and put rods, these Harrington rods, just like this, stainless steel. Ow. Anyway, but back in the old days with her, they wired it into place. Well, she's an avid horseback rider. So riding in upstate New York, she would bounce around on the horse, and next thing you know, the rods started coming loose. So at 17 years old, 1 year later, they took the rods out. When they took the rods out, this is what her spine bent into. When she came to see me, she moved from New York State down to Georgia, where I practice. This is what her spine looked like. Her spine is all twisted and contorted and bent. And I'll tell you what, if you do that, if you take a spine and twist it and contort it and bend it like this, and you have a spinal cord inside there that's acting like a fiber optics cable, and instead now you have a cord that's getting twisted and bent up, kind of like this. So say this is your spinal cord, and it should be nice and straight, but now we're taking it and doing this kind of thing. How well do you think that's working? How well do you think that's sending messages from her brain? Once again, this is on your back, just like this. How well do you think it's sending messages from your brain to tell your liver, your spleen, your kidneys, your colon, your bladder, how well to work? Obviously not well. That's why we start to see a lot of health conditions coming from this, like I mentioned earlier. It's not just a cosmetic problem. It's an overall health issue. Now, what do we do for this? Very simple. We do conservative chiropractic care. Nothing invasive. Very simple. If you know what you're doing, we do corrective care. So what that means is this. When patients are in the office, they're laying down on the table. Here's me adjusting a patient here. And I put my hands on his low back where the curve is. So I know exactly where the curve is. I'm always using the points on the bone here. You can see sometimes they stick out this way, sometimes they stick out this way, sometimes they're this way. I use those as levers to make the adjustments, to straighten the spine, to take out rotation, to take out what we call wedging. So sometimes the spine can rotate like this, and sometimes it wedges like this, and sometimes it does combinations of that. Well, if you know what you're doing and you're a corrective care chiropractor, you know exactly where to put your hands to start to gently put the spine back in alignment. And it's that simple. Now, obviously, it's always better when you can catch it young, when you can catch it when the child's 4 years old, or 10 years old, or maybe even 15 years old. It's a lot harder to correct when someone gets older, in their 30s, 40s, 50s, up to 80s, but it could still be improved, and that's the key thing. Even if the spine isn't completely corrected, it's still improved, because if we could stop the degenerative process, if we could take the pressure off the nerves to allow the brain to be able to communicate with the body the way it's supposed to, you win. You win. That's a victory for you, because if you continue to allow it over time, what's it going to continue to do? Get worse and worse and worse. And how many times have you seen people like this? They're walking around all hunched over. They're like this, and you're thinking, wow, what did that person look like when they were in their teens? They weren't like that. I used to work in an office where a gentleman would walk by to go to the dentist right next door to me, and when I say his spine was completely bent over at a 90-degree angle to where he was looking at the floor, he had to have someone holding his hand to guide him into the dentist office. You got to think to yourself, he didn't look like that when he was in his 50s or 30s or 20s. He grew into that position. You grow into scoliotic position because of your posture. And then you know what? It gets worse and worse and worse. If your posture starts to get more curved, guess what? Now you're more apt to fall, have issues when you get older where you have balance issues. And what is every senior worried about? Breaking a hip. Not only that, if you have malposition, in other words, it's positioned improperly, and now you don't have equal weight bearing here, you also have the risk of compression fractures. The vertebra can actually break, and we see patients like that when they get those big bubbles on their back, and you've seen that. That big bubble is more compression fractures here, and then here, and in here, and it gets worse and worse and worse. It keeps breaking and breaking and breaking till they get a big hump and bubble on their back, or, once again, a scoliosis. So, this is Annalise. This is one of our patients too. She came to me when she was 4 years old. The interesting thing about Annalise is obviously has a curvature in her spine. You don't have to be a chiropractor to see that. You can see a curve and you're thinking, why would you x-ray a 4-year-old? Because of that. Why wouldn't I? If a child's 4 years old and up, we're going to take an x-ray because I need to see what kind of problems we're dealing with. So we see a curvature here. 3 months later, her spine looked like this. Now, once again, I'm a corrective care chiropractor. It takes more correction, not just your typical just rack 'em, crack 'em things. You can't just make things pop. You have to know how to align it properly. And that's what we did here. The bonus with this was this. Not only did we get her spine straightened out, this is a published case study of her where she was a type 1 diabetic. We actually helped her with her diabetes to where it was virtually eliminated, and this is a peer-reviewed published study, I was actually published, talking about how well she did, how much improvement was done in her A1C levels, like the patient I talked about earlier. Oh, I'm sorry, one of our viewers earlier. So that's what could be done. And I'm not saying that to pat myself on the back. It's just to show you how incredible the body can heal itself. Because I didn't heal her. She healed herself. This young girl healed herself, Annalise. All because we were able to straighten her spine out, allowing the healing power that God put within her body to flow from her brain down and out to her tissue cells, out to her pancreas, out to her prostate. Not her prostate, it's a young girl. Out to her colon, I should say. Out to her bladder, out to her lungs, out to her heart. So by straightening the spine, all her organs work better. And it just happened to be, in her case, her pancreas worked even better. Okay? A lot better. Now, William, 13 years old. Once again, William's got a 10-degree curve here. Okay? So he's in that watch and wait stage. At 13 degrees, what's that going to look like when he's, at 13 years old, what's that going to look like when he's 20 years old, 25 years old, 35? It's going to keep bending and bending. Why? Because gravity's pulling down. Gravity's always pulling down. He's not going to stay straight. He's going to start to get more crooked. So 6 months later, look at how straight his spine is. All right, once again, not to pat myself on the back, but it's about corrective care. It's about correcting the spine. Tanya. Tanya's 40 years old. She's also got a crooked spine. You can see here it tilts off to the right. Okay? So she was walking crooked, didn't even know it. So her rib cage and her pelvis, we call it a translation, which means it was shifted over. So she was shifted over. She had a curve here, and then it came back to here. Now look at how straight she is. She's only 1 degree off here. So if you draw a plumb line, 1.9, so about 2 degrees off. But you know what? She can live with that. She will be fine living a long, healthy life with a spine nice and straight like this. Now, like I said, this even helps senior citizens. This is Cynthia. Now, when Cynthia came in, she had no idea that her spine was this crooked. Her spine curved out to here at about 12 degrees, right? And then curved back here. Why that's so dangerous for her is because her upper part of her rib cage and lower part and pelvis didn't line up. So she was completely translation to the right. Her torso was translation to the right. Her hips were to the left. When it does that, that puts her at a higher risk of falling, higher risk of having balance issues. And like I said before, the number one concern for seniors, other than maybe heart disease or cancer, is falling. You don't want to fall. Your risk of breaking a hip goes through the roof. And when your risk of breaking a hip goes through the roof, your risk of dying in the hospital goes through the roof, okay? About 25% of senior patients who ever go into the hospital don't leave the hospital. So number one concern, like I said, other than heart disease, cancer, things like that, is fracturing a hip. So what do you think, how do you think this is affecting her? Her spine now is perfectly straight. Look at that, perfectly straight. So she's walking better, she's standing taller, her posture's better. Now, once again, I'm not claiming to cure things because her body's able to do that. That's the healing power that God put within all of us, is giving her the body the ability to heal better. But all I did was remove the interference. We always say God doesn't need help, he just needs no interference. Align the spine so that the nerves can flow, the brain can communicate and control the body the way it's supposed to, and your body's got the best chance of healing. Like I said, the body's like a fuse panel. If it's like a fuse panel, you want to make sure that all those fuses are turned on, right? Makes sense. Well, guys, I hope this is good information for you. If so, please make sure you like, you share, you comment, and subscribe. And put on that bell notification so that way you're notified every time we go on and put a video. You don't miss a single one. I want to make sure you get all of them. And if you need help finding a chiropractor near you, let me know. We'll help you find somebody. Because once again, my goal today, my purpose was to help save someone's life out there that needs help. And hopefully I was able to do that, and hopefully I was able to give you a little bit more insight and a little bit more information about this mystical thing we call scoliosis and how dangerous it is. It's not just about a curved spine, which once again, like I said, causes all kinds of emotional issues. It's about the overall health of your organs. So anyway, guys, I hope you liked the information. Please make sure you like, share, comment, and subscribe. This is Dr. Nick. I love and appreciate you guys. Keep those great comments coming. Keep those testimonials coming. And I'm going to keep on shouting out to you because you guys are rock stars. You really are. Anyway, have a blessed day. Bye-bye.